Hi, listeners. Today, I have a very interesting person with me. I have with me Dr. Maran. She is an interventional cardiologist, and she is in the US right now. And I'm going to let her tell us about herself. Hello, Dr. Maran. Thank you for being with us on this podcast.
Thank you so much, Shiva. It's so good to see you again. Um, as Shiva already introduced me, my name is Arasi Maran. I'm an interventional cardiologist. I'm the associate professor of medicine at the Medical University of South Carolina in Charleston, South Carolina. I am also the director of Coronary Chronic Total Occlusions, which basically means when you have a blood vessel which in the heart, which has been blocked for more than 3 months, I'm the person to come to. I literally bore a hole through that calcific blockage and restore blood flow. But as a part of being a rarity, a woman in interventional cardiology, I come across a lot of patients female patients who have a lot of concerns about heart issues and heart related health. Sometimes they feel a little dismissed when they go to my partners or other colleagues, and they would like to be talk to a female cardiologist for better understanding sake. So
Okay.
here we go.
But it's really nice that you being in such a position and doing something so unique. It feels really good. So you must have
Thank you.
actually come across a lot of people like that and asking you similar questions.
It's I mean, it's become a very common issue in this era, especially in this era, I mean the post-COVID era.
Right.
Exercise intolerance has become a very common problem for young people, who've
Mhm.
recovered without any issues from COVID, but they're not back to baseline. So I think it's a very relevant topic you have picked today.
Yes.
So uh,
So,
ask away.
yeah. So the first of all, I want to ask something very direct about tachycardia because I do have some clients who have tachycardia. I mean, high heart rate, and what would you tell them about working out? Because I want you to talk about it instead of me explaining what it is and how it works on a person and how could they work out with a condition like that.
So first of all, with tachycardia, all you need to figure out is whether it's a normal response to physical activity or an abnormal rhythm problem. Okay, all of our heart rates goes up when we exercise. That is a normal physiological response to physical activity. The heart, it kind of it's a very excitable organ. It responds to outside stimulus. Okay, if you're working out, it goes up. If you're dehydrated, heart rate goes up. If your thyroid levels are too high, it goes up. If you have a fever, it goes up. If you're anemic, it goes up. Okay, so this is all normal expected response.
Okay.
Apart from that, if the electrical circuit of the heart has a short circuit, so like how if you have a short circuit in a light bulb and the light bulb flickers and irritates us, that can also happen within the electrical circuit of the heart. That is a completely abnormal rhythm, and that requires immediate medical attention with medications and even an invasive procedure like ablation, etc. So that is a different topic. So the most important criteria is to differentiate whether it's a normal response to exercise or it's an abnormal rhythm problem. So if it is an abnormal rhythm problem, you and me can be talking, and suddenly my heart rate will just go up as we are
Okay.
talking. And for no reason at all, it goes up into the 150s, 180s, whatever. And then boom, it comes down. There is no provocation. There is no reason for it to come down. It spontaneously goes up, spontaneously come down.
Mhm.
That is usually an abnormal response. So
Okay.
if the other problem is you can be very normal sitting down, but just minimal walking from point A to point B, you will feel your heart beating out of your chest. And it happens every time you do a physical activity. So that could be the inappropriate tachycardia kind of a response. In those situations, there are still some medical conditions you need to rule out. You need to make sure you don't have blockages in the blood vessels of the heart. You need to make sure your hemoglobin levels are okay. You need to make sure you don't have a hyperthyroid. That is, the thyroid is not overactive. You don't have fever. You don't have any flu-like symptoms. You're not dehydrated. Or
Mhm.
a Friday night, yeah, I can talk in Tamil
Yeah,
also,
yeah.
right? Friday night, Saturday night, nalla kudichittu next day morning poi exercise panna, you can have the same sort of a abnormal response too. So
Okay.
that is just the normal response of the heart. Heart is doing what? It's basically telling you, hey, oh, something is wrong, poi tanni kudi, or go check your hemoglobin. And the mother, it is indicating to you. And the last but not the least, if you have never exercised, okay, and you're a slug bear and you love being a slug bear, there's nothing wrong with it. Some people just enjoy that. And suddenly you are trying to exercise, your body is not used to it. And your body is
Right.
like, what is going on? How dare you exercise me? It will kind of challenge you back and you'll huff and puff. And so these are the normal situations. So we'll talk about medical reasons. Consult your doctor,
Yeah.
treat the medical conditions appropriately. If you have no other medical conditions and you're noticing that your heart rate goes up, okay? So when you said my patient has tachycardia, everybody has tachycardia. All of us have tachycardia, okay?
It's
So it is
true. High
not
levels of cardio, it goes up anyways.
yeah, you have bradycardia if your
Right.
heart rate goes down. Usually when you wake up or you're sleeping, heart rate goes up. And kalamre endrikumbodhu and the stress of waking
Right.
up itself, your heart rate goes up. Okay. So tachycardia is not an abnormal diagnosis or anything of that sort. So the what I would say is get up. You've decided to exercise. Go exercise. Your heart rate comes up, and usually the heart is a drama queen, okay? Everything related to the heart will be very dramatic. Impending sense of doom, necklala, you'll feel your pulsations, you feel sweating, you feel like you're going to die and all that stuff. Just sit down, okay? Just sit down and it'll come down. If the heart rate comes down, that's fine. So note the time, how long it takes for you to get to that situation.
Okay.
If it is 5 minutes, don't exercise till 5 minutes. Exercise for 4 minutes. Wait and see how you feel. Take a 2-minute break even. Then again exercise for another 4 minutes. And keep doing this literally for 2 weeks. And the third week, you'll be like, I can exercise for 6 minutes now. And then you push your limit to 6 minutes. And you keep doing it in a matter of 6 weeks to 8 weeks, you will be able to exercise for 30 minutes, 45 minutes, like that. So that is a slow and steady way of figuring out. I have patients, I've told them just walk for 30 seconds and take a 2-minute break. Then take another walk for 30 seconds because your body is not used to it and it will fight back. Okay, it will fight back. And you just have to figure out how long it takes for you to you don't want to go and you don't want to live in that uncomfortable impending sense of doom. If you keep going there, you will quit exercising. So before that, you stop and you slow and steadily increase your exercise capacity.
Right. So that means taking good rest intervals is actually almost mandatory because you'll want to. See, even otherwise, when people work out, I always tell them, wait for your heart rate to come down. Don't be huffing and puffing and try to move on to the next set. Wait and then take the 30 to 60 seconds or 60 to 90 seconds rest and then start. So it would apply the same to them. Maybe the rest interval is slightly more than a normal person.
And it's okay. It is absolutely okay. So, this is a journey. Okay. You need to reach the destination. There's no emergency to reach 1 hour of high intensity training today itself or tomorrow itself. It's okay if it takes, your body, the human body, resilient organism, you just have to be patient with it. Know yourself, make sure you're well hydrated before, you've had a good night's sleep and, make sure the other factors are in line. Sometimes aerobic exercise can be very hard for these patients, okay? So walking can be very hard. Running is almost impossible. So we tell them to do stationary exercises. Bicycle, stationary bike is a good one. Elliptical is a great exercise. Rowing actually is very good. It's whole body without doing that. But you have to be just slow and steady. And my favorite, weight training is a fantastic form of increasing your exercise endurance without feeling all this fainting and all that stuff. What I tell them is till they reach that 30-minute capacity, don't stand and do weights. Sit on an exercise ball, a Swiss ball or something like that. Do a lot more sitting exercises till you get used to it. Then go light weights or play around with it. Sometimes you need to be your own body's detective. What is provoking it? What makes it better? So a little bit of introspection is also needed.
But this is good because I read somewhere that for people with any heart condition, don't add too much of resistance to your workout. But I think they are, what they imply is something very heavy. So we're not going to be
So
doing something very heavy. Mild resistance is anyway good.
no, we are talking about 5 pounds, 10 pounds
Right.
for men, and 30 pounds, 25 to 30 pounds for men. Okay. So the resistance you are talking about 100 pounds, I mean,
Yeah.
100 pounds is 50 kilograms. On the madri, that heavy lifting and that heavy deadlifting, adala you definitely
Yeah.
don't want to do. And obviously, before doing any exercise, if you haven't done, if you are middle aged, that is, if you are in the 40s and 45, especially for men, it is not unreasonable to go to your doctor and just get an exercise stress test. Okay.
Right.
And that's a great way to know what is safe for you also. And that can save as your baseline. The அடுத்த வருஷம் டாக்டர் அதே டாக்டர் போயிட்டு do the same stress test, you can see how much you have
You've
improved
improved.
also. And you can give that to your trainer also. The trainer will know, oh, the patient started feeling uncomfortable at a heart rate of 115. So you can even do heart rate monitored training, which all that
Yeah.
stuff. Yeah.
So we mean generally I do something with an RPE, and then some of them have their devices, so we check that way. But otherwise, mostly clients are also aware of their conditions. But what I'd like to know is, can you reiterate the fact that exercise is probably important for anyone with something that does not require a medical intervention immediately, but something that's common? Can you reiterate the fact? Because it is quite
So
scary. People
Shiva, it
think,
is not. It is the most important secret sauce of life. Okay, if you want to increase your quality of life, if you want to increase your quantity of life, that is how well you're living and how long your lifespan is going to be, there's only one thing which we all can do is exercise. Okay, 30 to 45 minutes, 5 to 6 days a week of exercising improves your quality and improves your quantity. So let me reiterate about how it improves your quantity of life. Okay. I do chronic total occlusions, I told you, right?
right.
Where the blood vessel is 100% blocked. This blockage does not happen in 1 minute. Like, it's not an acute heart attack. It happens very slowly over time. It
Okay.
happens so slowly over the time, patients themselves don't realize they have 100% completely blocked
Blockage.
vessel.
Okay.
Okay, because the blood, the human heart forms collateral flow. Okay, the more you exercise, the more collateral flow your body develops, and the lesser chance of you having a heart attack because of that.
Okay.
If you don't exercise, if you have a chronic total occlusion, you can't walk from point A to point B. And those are the patients who come to me. I have to open them up because they on the exercise boat has gone. They can't
Okay.
exercise anymore because they have a blockage in the heart. I will have to open that blood vessel so that they don't have chest pain when they are hurting. Okay,
Okay.
so that's just one example. Exercise improves insulin sensitivity. So it prevents you from getting diabetes. It prevents heart attack and strokes from happening. So these are all quantity of life
Right.
measures. Quality of life, you feel good. I mean, the endorphins which is released by exercise is unmeasurable. It is the most underutilized antidepressant. When you're sad or anxious or restless, instead of grabbing a bag of chips or bag of cookies or a chocolate, go for a walk. Not even an exercise, just go for a walk outdoors or somewhere. You're going to feel so much better. So it makes you happy. It's same dopamine receptors hit by chocolates and alcohol is done by exercise. Your balance improves, which is extremely important as we grow old.
Older.
Okay,
Yeah.
20s and 30s allow, okay, but 40s hit panona, you have to think about your 50s and 60s. How
Right.
are you going to be? What is your health going to be? The walking stick or nadaka poriya, let it tana nadaka poriya. It all depends on the stuff you do in your 40s. Okay, so it improves your muscle strength and therefore it improves your balance. Okay, so I'm not saying that exercise completely prevents heart attack and strokes. Okay, it prevents, but if you're an exercising person and you end up with a heart attack, the heart attack is much smaller, recovery is much faster, you're back on your feet exercising again much quicker. So the benefits are innumerable, and literally there is no downside to it. There is
Right.
absolutely no downside to exercise, seriously.
Yeah. So that actually, I'm going to ask you something not connected to the heart, But since you mentioned this line, I'm going to ask you this. When you say there's no downside to exercise, most of the clients will usually, relate anything new that happens to them with exercise. Like when they start working out, uh, why am I having frequent headaches? I think the newest thing I did was workout. Why am I feeling dizzy? I think this must be the workout. Then why am I this? I think I've gained a few more pounds. I think it's the workout. So they never relate to what they do during the day or what they do, during the night. But they always relate it back to exercise, which is basically, like you said, has no downside if done
It's no
correctly.
downside.
Yeah.
Yes, there's no downside, but you also have to be mindful of what your
Right.
body has done also. So let's say நீ exercise பண்ணாம ஒரு trainer Shiva Devraj கண்டுபிடிச்சிட்ட 1 hour intense workout பண்ணிட்டு and you are able to do it. And sometimes when you're young, even though you haven't exercised, you can do an intense workout. That's it. You will have some body like,
Yeah.
what just happened right now? Okay. I was நல்லா உட்கார்ந்து டிவி பார்த்துட்டு இருந்தேன். என்ன போய் what have you done to me மாதிரி. So you might be a little bit more dehydrated, you're a bit more tired, you might be a little bit more hungry than before because you have a calorie deficit right now. You might have burnt 600 calories. So you have a calorie deficit now. So the headaches you're getting after an exercise could be because you're dehydrated,
Yeah.
and your body has utilized there's something called afterburn. You know that,
Yeah.
right? Even if you have burned 600 calories during workout, you might burn an extra 1,000 calories the 24 hours to 48 hours after exercise because of the workout you have done. So there's an ongoing calorie deficit, and the shortest and quickest fuel for this afterburn is glucose, glycogen, stored fats. So your body is recycling all of those. So your glucose level might be going down. You might need to eat a little more high protein food, not junk food, but high protein food. So things like that. So yes, your body is going through a change. ஒரு புது வீட்டுக்கு போனாலே எவ்வளவு வீடு புதுசா இருந்தா கூட இங்க ஒழுகுது அங்க ஒழுகுதுன்னு சொல்றோம்ல, அதே மாதிரிதான். If you do something new, there will be changes. It does not mean you have to stop exercise. It just means, okay, this is all happening, I need to do extra thanni kudikano, konjam extra, maybe I have more chicken or I have more beans or something like that for protein, and go back the next day. It's it's an ongoing process. புது வீடு ஒழுகுதுன்னு சொல்லிட்டு வீட்டை விட்டு விளையா போயிடுறோம். We just figure it
but
out,
they do
right?
have very strange questions. Like that's a totally like a day's worth
And
of
it's okay. What hasn't killed you is only making you stronger. So that's the problem, right? Sometimes instead we'll be like, oh, எனக்கு இப்ப தலை வலிக்குது, exercise நாலவோ,
exercise.
oh,
Everything is exercise. Yeah.
முட்டி வலிக்குது, I think it's because of exercise. I'm like, so what? முட்டி வலிச்சா, I mean, and patients, all they need to know is பயம். Okay, எல்லாருக்கும் ஒரு something, am I doing something I should not be doing? And exercise is not, till you get addicted to exercise, till you see the positive feedback, or your muscle mass is increasing, and Allah varavarikum, exercise is difficult to do.
Yeah.
So our lizard brain wants to go back to the TV, in front of the TV. So it is coming up with excuses. Okay, so ipada number evolved brain should say, no, okay, lizard brain, nee adanga velai, na poi exercise panna poren. Really, you need to kind of re-educate yourself and reiterate it. There is literally no downside unless you exercise funny, you've torn a ligament and your doctor has prescribed
injury
you
is completely different. Yeah, injury.
Exactly.
So which is why we work on exercise a certain way. Like we want to prevent. You can only do that much, but otherwise, so this is like a generic thing that clients usually come up with.
So I mean, my personal story, I very bravely decided to have 3 children. Okay. And very bravely, the third child was when I was 38 years old. Okay. It did a number on my body. Literally. Now I understand. Even though I'm a doctor, I'm like, chacha, I can do it. Nammala panna mudiyada. Evlovo pannito idu panna mudiyada. That's only 38 la I had. Then literally after my third baby, my hip started hurting so badly. It was just impossible. But mind over matters. Arasi, you can do this. And let's start running. And one of our common friends, Uma, she was a pulmonary critical care who runs, and I got motivated by her. And we said, I've tried running in my life 6 times and I have failed 6 times. But I haven't stopped. Okay. So then I've just basically realized running is not for me. Okay. Now I bike, I row, I do heavy weight. The 25 to 35 is heavy weight for me.
It is
I do
good, still good.
weightlifting, but it's a work in progress. My
Yes.
daughter is 6 years old. First year, I was very busy with everything, but for the past 5 years, I never gave up. I just found alternatives. So there might be certain exercises which is not suitable. You don't give up right away.
Right.
6 times, my husband was like, "What is wrong with you? How many times you have to run and enjoy your hip before you realize this is not?"
Oh,
I was like,
gosh.
"How dare it does not?" So that's what you have to challenge your body. So my question is, how dare my body does not let me run? Like, what are the exercise I should do? Maybe now after biking and stuff like that, I could probably go back. But now if I'm just worried if I injure it again,
Rowing is good
I'll
enough.
set it back.
Yeah.
So, but now I'm very happy with that. So the thing is, you have to challenge your
Right.
body. If you want to see change in the future, you want to see a healthier body, healthier mind, you need to change something today.
Yeah.
Okay. And that can be a small change, and you can't say change panna valichudha vitita. அது சேஞ்ச் இல்ல சேஞ்ச் பண்ண வலிச்சது பொறுத்துக்கிற மாதிரி தான் இருந்துச்சு அந்த வலியை
I'll try
பொறுத்துட்டு
again.
I kept going.
Yeah.
That is the thing.
Yeah. Thank you so much, Arasi, for your time. And I know you have a very busy schedule, but you still did give us some time. Thank you so much for all the insights you gave for exercise. And I know it came from personal experience plus your professional experience combined. So thank you so, so much for this. We'll
Thank
catch
you,
up
Shiva.
again with another topic.
Yes, thank you. You take care, okay?
Yeah. Take care.